I start, you have any question? We had 2 seminars. I'm going to summarize for you what we have done, and then we are going to do some interviews, real interviews. So you will have some idea. You don't want to go for an interview and never had one before. So I have given you some case scenarios. Have you received the cases? I send you 6 cases just to start. Okay, so let me just summarize what, and you can interrupt me. It's a very small group, so you can interrupt me anytime. Um, I hope that you have read all the material I asked you to read on day one. ECFMG, ERAS, match, all that. You need to be absolutely 100% confident that you know this stuff, because you don't want to make a mistake and then find out later that you could have done the other way. So that if you don't understand it, do it again. Do it again. Keep reading it. The application process is long, tedious, and confusing at times. And I think the first hurdle would be the personal statement. Um, I would strongly suggest that you rewrite your personal statement. Have somebody at a senior level review it. My level. I'm senior. I'm much senior to you than to any one of you. But you need somebody. Don't have your PGY2 friend review it. It's okay, but that is not enough. You need a faculty person, somebody you know very well, someone who knows you very well. You knowing that person is good enough, but that person has to know you so they can add something to it. Personal statement, as it says, is personal. It has to be personal. It has to be written. It is like buying a shirt. It has to fit you. You cannot just pick up something. Maybe it will fit, but that is not the way to do it. It has to be done for you. So, and it doesn't have to be a US faculty. It can be back home, wherever you come from, uh, and have them help you. And I'm sure you do know people in your medical school, or if you've done postgraduate work in your postgraduate school, who will draft or craft a letter for you. The other thing which I may have told you, but I forget sometimes, have that person call the program director here. Let's say we are coming from New Delhi or Mumbai or Lahore or someplace, and you know some people down there in your medical school, and now you are going for an interview. Have that person call the program director here. Now, unfortunately, we are limited because of the time factor. You know, if somebody calls from New Delhi, they are 10 hours ahead of us. So you have to really think it through and not disturb somebody in the middle of the night. So the better way or alternative way is to send an email, a personal email, small 5 lines. Dear Dr. So and so, I have written a letter for Dr. So and so, but I want to re-emphasize his qualities and a few words, good words. And so please take a careful look at this applicant. Thank you. That will go a long way. If there are 25 applications on my desk, and if I get one letter like that, that person becomes number one on my choice. Because I don't know anyone. So it is important that you make a personal contact through your program director back home. Do not undervalue that asset. It has to be done. And we went over personal statement. Please do not use ChatGPT. They will find out. If you use Chat, you may use it, but then make sure that it is yours, not done by a computer. They will find out. If they find out that your statement was written by ChatGPT, they will discard your application. It's very important for you to know that. If you are a participant in a media, whatever media you may use, be very careful what you write. Because now program directors and their secretaries are looking at your media presence. So if you've written something bad or they think it is bad, they will find out. So be careful. That's all I'm saying. Um, I told you to follow this is a historical way of writing a statement, logos, ethos, and pathos. And I hope you have read about it and follow that line. It always works. That's all I can tell you. I'm not a good writer. I can read a lot, but I don't write. Now I'm writing because I'm retired, so I am having time. But whenever I want to write something, I follow those three lines and it comes out very well at the end. So you use that, it becomes part of your habit. I told you about English language. Now, has anyone done anything about it so far? I talked about English and Spanish. Has any one of you taken any steps in that direction? Please tell me. Dr. Patel, we have now spent 3 weeks on this, correct? Today is week number 3. Where is the action here? Anyone? Ishana?
Dr. Kothari, I've been practicing interviews, so English that way. I've been like practicing with my colleagues. Spanish, I mean Duolingo, uh, right now. C- But yes, I have to look into that aspect a little bit more.
Are you applying for this cycle right
Yes,
now?
I've applied.
And,
Yes,
and how many interviews you have?
I have around 3 to 4.
3 to 4. Okay. Are they live interview or Zoom?
They all Zoom.
They're all Zoom. Yeah. And that limits you considerably because in many things you really cannot show it during Zoom time. So your limited time, 3 to 4 minutes really to impress. So how are you practicing? Besides going for the real interview, how are you practicing? This session today is going to be interactive like this. I'm going to ask you a lot of questions and I hope you will respond. Don't be shy. Just say it loud. So how are you practicing? How are you preparing? Let's say you are interviewing with me tomorrow or next week. What is your prep?
So, the first step I've been taking is that I'm trying to like get all the questions from wherever, whichever, whatever resources I'm able to find, and then compile all the questions together. Have a list ready of around 150 questions. I think I have around 150 questions. Trying to just read through and like think of answers in my head. The next step is like with a lot of colleagues, IMGs I have met during my journey of rotations. I've connected with them and then we try to practice it with each other. We do a Zoom session just like this. And we try to like, initially we throw like 5 questions at each other and we wait and like the other person's acting as the interviewer and the other one is answering it and then we just like reverse the roles. Then we also try to like do a quick session, like just throw the questions and like have points from the other end. So that is what we do. And then we give each other feedback. And then we
This
also,
you do it with your colleagues, the same level as you are or senior.
so these, so one of the sessions that I've done is with a colleague. Second has been with a resident. Third, I'm trying to get in touch with a preceptor who I had the opportunity to work with. So I am trying, but depends on the schedule. I'm able to.
It's difficult, but you need somebody who has a lot of experience in this. You cannot depend on a PGY1 who was your college mate last year. They do not have that breadth of knowledge of what to say, what not to say, etc. So don't underestimate the prep time. It is absolutely necessary Because basically, all of you have the talent from my point of view. Because I have a long lens. I can see things which you cannot. Simply because I'm a lot older than you. And I have gone through these cycles after cycles after cycles. And you do not want to make, you don't know what they are going to ask you. It really depends upon the mood of the program director and the faculty that day, that minute. But you can assume certain generic things will be asked. So one opening question is, tell me about yourself. So you're sitting in front of me on Zoom. I see your background is plain. There are some flowers there, which is nice. Keep it simple. That's fine. Blank is fine, but don't clutter it with musical instruments and things like that. People do that all the time. You are well dressed, very presentable, so that is important. You have no idea how people arrive sometimes. They as though they woke up from sleep. I told you about technology. Make sure your machine works. Many times people do not come on time because the internet did not work. Now I don't know, where are you now? What country are you in?
I'm right now in US. I'm in New Jersey.
You're in New Jersey, okay. But if you were in another country, particularly this, Central or South America, you cannot depend on the internet. That is a big problem. So you need to, now I don't know how to fix it, but something to consider. Because if the machine doesn't work, then there is no interview. And they are not going to wait for you to come back. So let's start. Okay, can we do some mock interviews right now? Are you ready? What
Okay.
about the others? Okay, I want everyone to participate in this. So it cannot be just one person talking. You all need some practice. And please don't be shy. Don't be afraid to make a mistake. This is the place to make a mistake. You don't want to make a mistake in a real live interview. So, good morning. You introduce. So, how are you going to introduce me? You are entering my office. I'm sitting here. So, let's start with the entry.
So
Go
should I
ahead.
go ahead, Dr. Kothari?
Anyone.
Okay. I think there are four more people as well. Anyone who wants to go ahead?
Go ahead and introduce yourself. We are going to interview you.
Sir, I can
You're on
start.
Zoom. You're on Zoom. Anyone. There is no reason why everybody cannot participate with such a small audience.
Hi, good morning, everyone. My name is Dr. Kartavya Singh. I am a recent IMG, graduated this year from India, and I am a fresh applicant and at this year's internal medicine residency applicant. I'm ECFMG certified, and I'm currently in US. I currently completed an observership at St. Peter's. Right now, I'm prepping for my Step 3 exam and actively looking for interviews.
Okay, let's then now ask others, what do you think about that introduction? Make a comment. He told you that he is a fresh graduate. He said from India, right? That's what you said. Now, India has 300
Yes, sir.
medical schools. So don't you
Uh,
think you should mention the name of the school if you're going to go that far? Because as we all know, all schools are not created equal.
mhm.
So you need, if you're going to introduce your background, I think the school should be named. Now, is it necessary? No, because the program director has your entire CV in his hands. So probably it is not necessary. Remember, you have 3 to 6 minutes to make impression. So how are you going to use your time? You don't want any unnecessary information which he or the program director, he or she, can obtain just by flipping a page. That's important, very important. So rephrase your introduction and make it short and memorable so that the program director would know who you are. Anybody has any comment on his introduction of himself? We are trying to improve our presentation here. Your presentation is fine. I don't want you to think that I am criticizing your presentation. It's fine. There is no correct one. And your speech was what? Was any comments on the speech? Um, Somebody make a comment on speech? Okay, good. So that was he's not mumbling. Most South Asian people, like me and you and others, mumble. I told you the story of my experience with President Kennedy's teacher. You remember that? And the
Yes, sir.
lady who taught President Kennedy at the age of 17 to speak publicly told me, when I went to her to learn to speak better, she said, "You are speaking above the clavicle." My voice was coming from the vocal cord, not from the diaphragm. That's what she meant. In your case, you are speaking clearly and loudly. I could understand that. Don't forget that. Practice. The only way you can remember is by practicing. So take a deep breath and engage your diaphragms to create the voice. That is the most fundamental thing in any language, whether you speak English or Gujarati or Hindi or Chinese, you have to be heard. So you must practice. And you don't know how you sound like because you don't hear you. So what do? You tape record yourself. Get your rather inexpensive tape recorder. You can on your phone can record you and replay it back and see how you sound. Because that's how other people will hear you. So that's important. Okay? So now we introduce ourselves. Uh, Handshake is always welcome, though in the era of COVID, that is disappearing, which is fine. Um, the handshake, what kind of handshake do you want to offer? Is there anything you should know about the handshake?
Is a firm grip?
Firm but not uncomfortable.
Yeah, yeah.
People overdo it all the time. But it should be substantial,
Mm.
forceful. And your hands should not be sweaty. You are likely to sweat because you are under a lot of stress. So make sure that you have a handkerchief in your pocket. And before you enter, you wipe your hands off. Even though there may not be any wetness, make sure about that because there is nothing worse than shaking hands with somebody and you feel that your sweat came on my hand. These are little things, but they make a big decision making process. Okay, now you sit down and the program director starts by saying, "Tell me about yourself." So, who wants to tell me about himself or herself in this small group? And after that, we are going to do the cases. Dr. Singh, you want to start? Tell me about yourself. It's an open question. So, you can basically say anything you wish.
Okay. Sir, am I audible?
Mhm.
Okay. So I can start. So, sir, good morning. My name is Kartavya Singh Yadav. I recently completed my MBBS training at HIMSR, Ahmedabad Institute of Medical Science and Research in New Delhi. And that's where I developed a strong foundation towards internal medicine. This was specifically during my internship rotations and during the time when I got the opportunity to serve in the underserved communities in and around Delhi, and I could see a high volume load of patients in government hospitals. So after graduation, I completed a few rotations in US, strengthening my US clinical experience throughout the country, like in Chicago, then in Miami, New Jersey. Uh, right now, it has taught me a lot about the patient-centered care that US has and the team-based approach that they follow around here. And coming to US has also taught me about the cultural sensitivity, especially the influence of the large Spanish-speaking population here. All in all, this experience has been a wonderful one for me and quite a steep learning curve. And because of with like everyone's grace and my knowledge, I'm here sitting in front of you, uh, discussing about myself. Thank you.
Okay. Any comments on his opening statement? It was good. It was very good. But could you have done better? Okay. Who is talking? Okay. Oh, okay, Jimmy. Okay. Okay. Yes. Yeah. This is a common flaw among most of us South Asians, particularly, because our language is whatever you speak, Hindi, Gujarati, whatever it is, they are fast languages. And when you superimpose English into it, the English becomes faster. So you have to deliberately slow down. And it requires practice, like anything else. That's all it is. But I like your opening statement. Just make sure it is not too long.
Okay, sir.
Uh, at some point, you need to close. And then I think the opening statement, tell me about yourself, should probably have some personal information. I come from a family of doctors, or I am the first doctor in my family or in my town. I had a student, a IMG, who was the first um, doctor in the entire village. And the whole village came to give him a send off. Well, it's an interesting story. Is it important? No, everybody doesn't have that, but something like that you should say it in the opening statement. You only have probably less than a minute to make that impression. Keep that in mind. The clock is ticking, and the program director is not in a mood to listen to everything you have to say because he or she has 10 applicants to review that morning, because usually we review 10 interviews, and you do it repeatedly over 100 times, it becomes a very difficult job for the program director. You have to look at the whole thing from the program director's point of view. How would he or she feel if you used a lot of time and redundancy into it? So don't repeat what can be easily obtained from the application. Okay, so let's do some cases. I have 6 cases here, and I would like each and every one of you to participate. So the first case is you are graduated from medical school in 2019. This is a very common scenario. And they're all real, by the way. They're all real. They are not made up. And worked in your father's clinic. Your father is a doctor, a distinguished doctor in your hometown till you arrived in the USA this year. Keep in mind that you graduated in 2019. Please present yourself to the program director and discuss your work from 2019 and now. Okay, who wants to handle this? You make it up. This is nothing I've written deliberately. You make it up. You graduated MBBS, you joined your father's practice, and now you're here. Let's say 6 years later. And remember that gaps in education are not looked upon kindly. Now, that doesn't mean that it is fatal. It is not. But you have to explain it why there is such a long gap, 6 years. Was it a gap because of a need? It could be a financial need, it could be a family need. If your mother is dying and you stayed there because of that, that gap can be easily explained. And I have seen that happen number of times. If it's a financial need, you didn't have money to pay for the airfare or come to America, you have to support your family, that is commendable. But say it clearly that I had to support my family because my father was sick and I had to take care of them first. Who would object to that? So be careful and genuine, whatever it is. So explain to me this. So who wants to handle this case?
I can try, Dr. Kothari.
Who
Oh,
is talking?
my name is Nigar.
Yes.
Can you hear me?
Yep.
Okay. Actually, this will be my first try. I haven't done any interviews before, so
And that's why we are doing it. I
yes.
want you to go for the real interview after this experience.
Mhm.
And I'm going to be deliberately harsh with you to
Okay.
immunize you against anything which can come during the interview. You have to practice like this. Somebody at my level, not a PGY2.
Yes.
Hopefully, you can find a mentor from your medical school, whoever you know, and say, please interview me. This is the weakness in my application I have. I have a 6 years gap. I don't know really in real life whether you have a gap or not, but a gap has to be explained. So how are you going to explain? Make up a story.
Okay. Okay. I will start. Hi, Dr. Kothari. My name is Nigar. I graduated from medical school in 2019 in Istanbul, Turkey. After graduation, I started working in my father's clinic. He's a family medicine physician, and he owns a primary care practice. Working as a primary care provider was extremely meaningful for me. In our clinic, I managed a wide spectrum of patients with hypertension, diabetes, dyslipidemia, and other common chronic conditions. Because our clinic was in a small city, I saw these patients. I saw many of these patients repeatedly over the years. And that continuity taught me the importance of long-term follow-up, preventive care, and patient education. And also this experience greatly improved my ability to communicate with patients. Although I appreciated working with my father, my goal has always been to become an internist. I worked with my father for 6 years because he needed someone to work for him, and I just wanted to help him in that way, and um, I wanted to uh, have the first job experience with someone that I know.
Your statement has been very good. Whether you made it up or whether it's real, I don't know. But it's very convincing to me.
Okay.
I'm listening for the first time what you're saying. And it's very, very well done.
Okay.
Whether you prepared for this, I don't know, but it's very well done. Number one. Number two, you added, without probably knowing, you added the three elements, ethos, pathos, and logos. You brought the human element into it by saying that your father needed help and you chose to help him. That is commendable. Nobody can object to that. It is very commendable. And you were very natural. So stay that way. Don't change. There's nothing worse than being scripted, as though somebody forced you to remember those things and spit it out. Your speech, what you gave about minute or so, was very natural to me. That's what you are trying to impress me. And so that is good. And keep on the same path and practice more. Because you already explained the gap. Why such a gap? You wanted experience, you are interested in primary care, and more important, you wanted to help your father. So why change now? That would be my reaction. Why are we changing now?
Um, my goal has always been to become an internist since medical school. And now my father can support himself, can support his practice on his own, and he started to looking for other applicants, like any other doctor applicants. Um, and I just wanted to go after my dream.
That is also convincing. That is convincing. You want to, you sacrificed sort of for 6 years, and now you are ready, your father is ready to let you go, probably, and you want to fulfill your dream. I think that was perfect. So let's do another case. That's very good.
Thank you.
Let's do case number 2. You graduated from medical school in 2023 and entered into a graduate medical medicine program in a local postgraduate school. You know, in India and Pakistan, it will be the so-called MD, 3 years of residency, basically same as here. However, you decided to get married and you migrated to US. This is a very common scenario, particularly for ladies. They work hard, they get their degrees, and at the end of their education, they get married. And typically, they get married to a non-doctor IT guy, and then they come here. So, how are you going to respond to this? It's a tough one. This is not easy. Anyone else want to participate in this? Nobody? You need to have an answer. You cannot be quiet.
Dr. Kothari, maybe I can give it a shot. I am not in the same shoes, but I do know a friend who was in a similar spot. Uh, so should I introduce myself or like explain as to
No,
why?
let's do it from the middle. We already we did the introduction part. I have few objectives today. Is number one, introduction. How do you address an opening question? Tell me about yourself. We did that, and that is not the only way. I just want you to practice with me watching you rather than go for an interview and then somebody asks you a question. So I always told you in the last 2 seminars that one of the things I would like you to do is to practice, practice, practice. But practice doing with your buddy who is a first year resident is simply not enough. You need a mentor who has number of years of experience, some class some standing in the society, things like that. So let us start with you, but skip the introduction part. The question is, you were doing postgraduate degree course back home, and now you landed in America because of your marriage. So how do you handle that issue? It's a sensitive issue. Respond.
So I believe that my passion for medicine has always been there, and that shows when I joined a PG course back in India, which was in internal medicine. But I feel sometimes life can give you unpredictable, like there can be unpredictable things that come your way. So I did get married, and I'm very happy with the decision I made. I have come to the US, but I did feel at one point that I do want to continue practicing medicine, which has always been my passion. So I started gaining experience, clinical experience, and tried to understand the US healthcare system better when I came here after my marriage. And right after a few months of marriage, I tried to do observerships in hospitals around my New Jersey area. I also have tried to prepare for my steps simultaneously while I've been handling my family, and I enjoy it. I'm getting a hang of multitasking now. So because I also wanted to apply at the program because it is right near my home, so professionally and personally, I'll be able to balance it both. So that's why I look forward to this.
You answered my question. I asked you about the change. What is your response to that?
The change has been because I was brought up in different parts of the country, so it hasn't been very drastic change. I have the adaptability quotient. I was able to adapt, but the culture was definitely different in the beginning. So it has taken time to learn the different cultural aspects, but it has grown upon me, and I'm able to adjust. The US healthcare system, in with respect to Indian healthcare system, has been very different. We generally write notes over there, and it's written documentation, but in US healthcare system, everything is computerized and EMR. So I that is why I wanted to expose myself by doing rotations over here and gain experience. So, but I also do and that's what I've been doing.
The real question here is, from my point of view, that there is no right or wrong question or right or wrong answer, but the real question from my point of view is that you are already an internist, right? Because you did 3 years of residency. And the real question I'm asking you, but I'm not telling you, is are you willing to go over another 3 years of training? That is because if you were in India or whatever country you come from, you would be practicing internist by now because you have finished 3 years of residency. US is probably the only country which does not recognize training overseas. Now they're changing. You remember I told you that limited license is now given to the internationally trained graduates. But the question here is, are you willing to go over? So you need to open that up upfront. I know that I have to repeat my training. Hopefully it will do me some good. But then you can bring up the internationally trained physicians and special license requirement. This was an opportunity. You have to be very careful so that the program director doesn't think that you're looking for an easy way out. But if the country opens up, 21 states are now giving license to internationally trained physicians. So you could have used that. Think about it, because it is not well known. Even your program director may not know that. But that was a good answer. But don't go all over. See, this is a tendency we all have. When you don't find out why that question is being asked. Okay, let's do number 3. You graduated in 2020. Back home, you entered an MD postgraduate program in OBGYN. This is the common scenario, particularly for women. I have seen number of Indian and Pakistani women who did postgraduate residency 3 years in OBGYN. And now they come to America because you got married. And now you're applying for medicine residency. Explain that. You can continue, Ishana, if you want to, unless somebody wants to kick in. I want everyone to practice this. You will thank me someday. Go ahead, there is no wrong answer. But you understand the question, why am I asking you? You spent 3 precious years to do OBGYN in a good place. Let's assume that you did it from a well-known medical school. And now you are in America, you got married to an IT gentleman, and you are settling in New Jersey, and you are applying for residency in internal medicine. What's your response? Why am I asking you that?
The change of fields, and plus I could have just
So
practiced.
you have to explain the change. Why are you changing from OBGYN to medicine? And more importantly, how are you going to adapt and why? What's the honest answer? There are many answers. So what answer are you going to give me?
So during my time in internship back in medical school, I had diverse exposure to OB/GYN and then even pediatrics, internal medicine. And I did realize at that time I was um, interested in OB/GYN and in medicine. So, and they were equally interesting topics to me. But because in India we have like a centralized exam and a national exam, uh, based on merit, I was not able to gain that higher score for medicine. But I was equally interested in OB/GYN. That is why I went ahead with that residency. And even before joining the residency program over there in India, I had 1 year of medical officer job that I did at a periphery center. And I was actively practicing medicine over there. So I've still been passionate about it, but I just not had the opportunity to do it. Now that I'm married and I'm in United States, I do want to take that opportunity to apply and give it another chance and to continue forward with my passion in medicine.
I will be very frank with you and brutal, and you'll hate me forever. It's a wrong answer. It's an absolutely wrong answer. And this is what most students do. They make a virtue out of something they have missed. Yeah, you went to OBGYN for 3 years for a reason. You wanted to become a top-notch gynecologist. And now suddenly you come to United States with a different set of papers and you suddenly fall in love with medicine. Is that convincing? Even if it is true, it is not convincing. So why not give a straight answer which is convincing and which is true? So what would that be?
Sir, can
Somebody
I give
help
it a
her.
try?
Somebody help her out. Okay, Dr. Singh. What
Yeah.
she should have said.
So,
By the way,
so
Ishana, because I'm criticizing you, don't think you are wrong. You're not wrong.
No, no, I need the brutal honesty, Dr. Kothari. Thank you.
Yeah. Go ahead, Dr. Singh.
yeah. So, sir, I'd like to say that when I chose Obs and Gynae for my MD program back in my home country, it was because I had a strong interest and like strong clinical experience in managing high risk patients and acute emergencies and whenever and all of the complex inpatient care with the experience you get with using your hand as a
Stop. I
surgeon
will stop
and
you
that.
here. I will stop you here because you're on the wrong track.
Okay. Okay.
What is the truth behind all this? What is the real truth? Remember,
So,
I
sir,
told you
basically,
in a mission statement, a personal statement, it should, number one, everything you write or say should be truthful. So, what is the truth here?
Uh, so I can just give it try to give it a shot. So basically, right now, according to my condition, like as I'm married, so Obsgyne over here is very competitive, competitive to get inside. So that's why I am just trying to start from the beginning, and I am.
It is the correct answer. That is the correct answer. You can say what you just said, that I would love to go. Don't kill OBGYN. Don't say that I'm very interested in medicine now, and I was interested in medicine 3 years ago, which may be true, but what you need to say that I would love to continue my work in OBGYN, but I also know that I do not have a chance in IMG, I do not have a chance to match in OBGYN. Therefore, I am selecting an alternative pathway to be a good doctor. That's all. And that would be the honest, and something like this, but acknowledge the fact that you cannot get into OBGYN program in this country or unlikely to get into OBGYN program. So medicine, nobody can fault you for taking medicine up. Everybody got this? Be honest.
Yes,
That's
sir.
perfectly okay to say that I am doing this because that is the best alternative I have to remain as a good doctor. I think that would be fine. But try to say that, well, I always loved medicine and I could not get in because of A, B, and C, and now I'm applying for medicine. That is not really true. If it was open field, you would have gone into OBGYN. And we have examples. I know people who have done that. It's not impossible to match in OBGYN, but it's difficult. Medicine is comparatively easy. In fact, your OBGYN training will help you to get into medicine because program directors like that. You have a free gynecologist on your staff. So I had over years at least 10 people who were MD in OBGYN and then came into medicine. They are very successful. So let's do the next case. Case number 4. Your application indicates that you took leave for 2 years in the third year of your medical school. Subsequently, you graduated in 2023. So another question on gap. Your application says 2 years of leave for personal reasons. So now, how are you going to respond to that? Now, remember that there is a law where they cannot ask you certain questions. So you don't have to reveal the HIPAA law. If it was, you could have taken a leave for medical reason, you were sick, or you could have taken a leave for a medical reason of your family, your mother was sick, father was sick. You could have taken leave because of financial reasons. Somebody had to pay for your education and house. So make up a story and give me the answer. Why did you take 2 years of leave in the medical school? Because if you don't explain it, that is considered to be a bad thing. You need to explain without breaking any confidentiality. Who wants to do this? Nobody? So a couple of people who haven't spoken. Kalyan, have you spoken? Yeah. Let's see, who can I? How about Mohammed? Palula? Well, anyone really. We don't have a large audience. This is, by the way, fairly common. People go to medical school, drop out for a couple of years, and then rejoin and graduate. So, how are you going to handle that? Let's assume that you had an illness, and as a result, you were advised to take time off, and you took time leave of absence from the medical school. It was granted by your dean, and you entered into a treatment program and you recovered and went back and then successfully graduated. That's the real story. So how are you going to respond to me? This is a very delicate situation because you don't want to say too much. You're not allowed to say too much. I'm not allowed to ask questions too much about your health. So how are you going to keep it generic and respond? Assume that there was a financial reason. Your father died, so there was no income coming in the house, and you had to support the family and work in your father's business. He left the business unattended. Let's make it a scenario. So true, I have seen that. So respond to me knowing that much.
So I can build up on that. So basically, I'd like to. There was the reason for my leave of absence for 2 years during my med school is because I am the first doctor in my family. So I am a non-medical. I have a non-medical background, and my father owned a small clothing shop in like the rural parts of the rural ends of the Delhi, which is the capital in India. But during the COVID times, unfortunately, my family business got shut down. And during that time, even my father, who was already a known asthmatic, he developed some serious conditions and he had to be hospitalized for quite some time. Owing to that, we had severe financial constraints, and I could not continue with my education.
Wait. He was hospitalized several times. Did he die?
Sir, he was critically ill. Like he was, no, sir, I wouldn't say. I mean,
But
critically ill.
you have to give some label. You have to say something, at least to the fact that he could not work.
Yeah, he was critically ill and disabled. So far,
The point, disabled.
and
Mm-hmm.
he was completely bedridden or I could say, sir, could I say like on long-term ventilator care for six to
You
eight
can say
months?
that, but make it
Uh,
short. Make it short.
okay. Okay, and because of that, our family had financial constraints, and I had to stop attending my med school. I had to cut ties briefly with everyone around, and I just had to take care of my family at that time, because that was my ultimate goal. I did not care about anything else at that point. But after this initial struggle phase of struggle passed, and we started to get back on our feet, I reached out to my college, and after a while, I tried explaining them my reasoning. I had a meeting with my dean who understood how my situation was, and he let me continue if I agreed upon taking extra classes and putting in the extra effort to completing everything as at par with my other peers.
Well, perfect. That's how it should come. Very natural, believable. It had ethos, pathos, and logos. You don't know that because you didn't plan it that way, but it automatically had all those elements. Because I believed you, what you said. And that is what your job is to make the program director understand what you are thinking. Don't assume that they will understand. Gaps are always a problematic issues. So you need to have a very good answer for the gaps. Gaps are not fatal. You can have a 5-year gap and return to medical school. That's okay as long as you can explain. Now, your explanation, COVID time, small business, your father critically ill, nobody is taking care of the business. Who kicks in? You. So you sacrificed your medical school, you went to the dean, you did everything right. Your dean was kind enough to grant you permission, and then you graduated. What better story can you tell? That's very good story. So keep this in mind. I think we'll do one more. It's 1 o'clock. We will skip number 5, but last one is important. Please discuss a memorable case where you provided care to the patient. So it should be a memorable case to you, and you were an instrument to provide the care. So let's ask our lady from Turkey. I can't pronounce your name. Because since you've done number of years of clinical work with your dad, you must have seen a memorable case, right? So think about a case and tell me what the case was all about and what was your role.
Um, there was this woman that I remember that when she
Mumbling, we are mumbling.
okay.
Go to the diaphragm.
There was this woman who was like 60 years old. She was in a lot of pain. Um, uh, I had never seen that someone that shows her pain with her moves. Um, and she has blisters uh, in half of her face and especially in her eye. Um, I immediately think about shingles. Um, then I because it we were working in a family care practice. I had sent her to an ophthalmologist because I thought it was an urgent situation. But I also arranged to follow up with me afterwards. Uh, yes, I'm sorry. I haven't prepared for this one, so I just think
You
about
need to be
I
prepared
can
because
give. uh,
that question will be asked. They
yes.
will ask you, particularly if you have done some time with your father or uncle or back home with somebody, they will ask you because it's not academic, right? If you did work with your father, there's nothing wrong with working with your father. I
Mm-hmm.
think it is an honor. Personally, I think it is an honor. But then you have to convince me that it was productive, it was academic, it was useful for your training. So, how do people learn? I'll give you a simple example cooking. Every woman in the world somehow knows cooking. The men don't, boys don't do that, but women do. How do you learn cooking? By observation. Your mother doesn't give you multiple choice questions. You watch her do things and you do it, mimicry. So it's perfectly okay to work with your uncle or father or a local nursing home in a non-academic environment, but then you should be prepared to answer a question. Now you tried to present a case of herpes zoster, which is a good case, but you should have then tell me that you are concerned. Why were you concerned? Let's say somebody has zoster in the face, in the mandibular area. It's a serious problem, but what would make you very concerned?
Um,
What
it,
clinical sign
mm,
would you like to see which will make you very concerned? You brought in an ophthalmologist. Why?
um, to, to prevent it to spread her eye,
No. Anyone?
uh,
vision loss.
for the spray to the brain and meningitis, it can cause.
No, 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 no.
Zoster
They're
on top
jumping too
because
far. They're jumping too far. Is there something she saw in this patient which made her? She doesn't have an eye problem. This patient does not have any eye problem yet. But is there something she might have seen which would make her think that she is going to have eye involvement tomorrow? Tomorrow.
Uh, generally there's something herpes zoster ophthalmicus when there's an involvement of the upper nerve, so that can lead to blindness, if I'm not wrong, cornea involvement.
I'm not, see, one of the things I told you, you will hate me. I told you by the end of this, you're going to hate me. But listen to the question.
Sympathetic ophthalmitis or some injury.
Say it again.
Sympathetic ophthalmitis or some injury to the eye.
No. You're too far.
Hutchinson sign. Like,
Anybody heard of a sign called Hutchinson sign or Nicholson sign? If you have involvement of the tip of the nose, tingling or numbness, tip of the nose.
Yes, leprosy. On the tip of the nose.
Poet, you're going too far away. Now, herpes zoster ophthalmicus, as Ishana said, the earliest sign is burning at the tip of the nose. Even the patient doesn't know that. So if you see a rash on the face and you think it is herpes zoster, you ask the patient, is your nose burning? He says, yeah, doctor, here I have burning. That means that tomorrow she will get herpes zoster ophthalmicus. Now, in your case, you thought that this was a memorable case, and it was. But then you should have prepared for all this and told the program director that this is what I thought. I saw her rubbing her nose. I thought she will get into eye, and therefore I immediately called the ophthalmologist and took care of it. That would have been a perfect opportunity for you to show who you are. Are you following my logic here? You see, memorable case is an opportunity for you because you can prepare. You can prepare from now till whatever. But then you have to study literature. It's not much, 2 pages, but read it up. It is already 1:10. I'm disappointed that very few people are attending. So I think there is something wrong with our publicity, or maybe you guys are not telling others. But we will meet again next week. Does this help what we did today?
Yes, definitely,
Yes,
Dr.
helped a
definitely.
lot.
Pardon? I
Yes,
didn't hear you, Dr. Patel. I didn't hear you.
yes, it helped a lot to prepare for the interviews. Yeah.
Okay.
So, can I just briefly tell about the patient I have seen?
Yep.
So basically, I am coming from the small village in Gujarat near the Anand, and I am a son of the farmer and only doctor in the from the village, the first doctor from the village. And so I'm talking about my father's friend uh, who was an alcoholic, and when I saw him, he was already like in a huge distress, and he was not willing to go to the hospital. So I encountered him in his farmhouse, and I just motivated him to and brought him to the hospital eventually. So he had the jaundice, ascites, and all the edemas of the 4 extremities, uh, and it was visible from outside. And uh, like when we went there, like where I was working, so in a small hospital. So physician told that he must require a liver transplant, and so if eventually we just do all the workup, and he got admitted to nearby regional hospital, civil hospital Ahmedabad, and he got his liver transplant done. And throughout this scenario, like I was contacting with the doctors and helping him around, like getting tests done, motivating him, and also I was supporting him in the transport, and like explaining him about the precautions to take.
I don't know where you're going with this.
Oh.
Why are you telling me this? What is so memorable about this? This is a garden variety case of an alcoholic who required a liver transplant. First of all, if you're an active alcoholic, you don't get a liver. You have to be sober for 6 months before they will put you on the list.
Yeah, so in between, he got admitted to the hospital for 6 months in a.
Yeah, but I'm not sure what is so memorable about this case. Is there anything unique about this case? Memorable means
Like,
you never forget. Unique. What is the unique part of this case?
so
I would not present this case because then you are giving the program director a lot of opportunity to ask a lot of questions which you may not have the answer for. So make it simple. I think the case of herpes zoster was very simple. Rash, pain, treatment. So prepare a case, one or two, maybe two cases you should prepare, brief cases, quick presentation, history, physical. Don't underestimate the value of history and physical. I wanted to, and I will emphasize next seminar about how to improve your history taking skill. Meanwhile, all of you need to go on what is called Stanford 25. You may have already gone. Stanford 25 is a program from Stanford University where they give you clinical skills. And if I were you, I would reach to every segment and master it. And make sure that during your interview, you tell the program director that I've finished the entire Stanford 25 series, genuinely. That will help you to get into favorable position. Okay, we have spent 15 minutes beyond time. Please spread the words to your friends. I'm really, really disappointed. There's a lot of work goes into this, and then only 5 people show up. That is really not healthy. And I have to rethink the whole strategy, whether I should do this. If it's helpful to one, I'm okay with that. I don't need a large audience, but you need to help me also. I'm doing that. Anybody has any question? Last question. We will meet next Wednesday again, and we will do some mock interviews. We will also do a mock clinical presentation at the bedside. I'll give you a script, and then I will ask you to present the case like you do during rounds. So you will have enough data to formulate an opinion. I will probably send it to you by email ahead of time. And then I will ask you to present the case to the group. Okay? Thank you all.
Thank you, sir.
Okay.
Dr.
Thank you,
Kothari, I
Dr.
had one question. I know it's getting very late, so I'll make it very quick.
Go ahead.
This is regarding the behavioral questions that we get asked during interviews. So can I give like one question which I was like really caught off guard and I wasn't sure what to do?
Yeah.
Okay. So one of the interview questions I remember there was an instance where will you help out your resident who is right now sick and wants your help? But you have like there was one instance where you are a little caught up with another patient or something like that and you have to handle the ICU on your own. So I understand we reach out to chief resident. That was one instant. But the second one, they tried to complicate it and they said that the chief resident has already taken care of that patient and your co-resident is sick and she still wants you to come and help out in the ICU. You're posted at a clinic and you just after 4 weeks of ICU that you're finished, now you have been asked to come because your co-resident is like sick and she wants your help, but the chief resident has already helped out and like with the patient and done it. So what is your next step? So I was like little off, like left, like should I help?
Who are you in this scenario? Are you a resident?
I am the resident who is at the clinic, and my co-resident who's at the ICU has fallen sick, and she wants me to come and help her out in the ICU. But I've already finished my ICU, 4 weeks of ICU. Right now, I have like one.
Don't go there. In a times of emergencies, you do what is best for the patient. If the patient is in the ICU and requires help from doctors, and there are not enough doctors, and you are the one in the clinic, which is a second level of urgency, but your attending has to kick in. the residents have no authority in transferring you from clinic to ICU. This is an attending matter. The attending in the clinic or the attending in the ICU should say, I want you here. That's all it is, because otherwise you are in a very compromising situation. Oh, she said no, go into a sick patient. That kind of, you don't want that. So what your answer should be, I will depend on the attending to decide what to do.
Okay.
And that's a proper answer. That's where you are an intern, so you don't have any authority to override anybody at this point. So I hope that is the correct answer for you.
I don't know the correct answer. I thought I'd ask you, but I guess that answers it. Thank you.
There is no correct answer for this.
I wasn't
There is
sure because I was like very caught off guard, and I was like, okay, what do I answer? Because I didn't want to directly reach the attending, because they generally prefer that you follow the hierarchy. So I was like, maybe I will reach out to chief resident, but they're like, no, chief resident has already helped you out. Now you don't involve the chief resident.
That is unfortunate.
So I was
They
like, I
should
didn't
not.
understand. I'm like, what do I do? Should I help? Should I do what? Like,
They should not have said that. This is a matter for the attending. If the chief resident would do it, but if the chief resident cannot or unable or unwilling, then it has to go to the attending, program director. And you can ask them. I said, I'm in a quandary here. Can you help me, please? Where do I go? Do I stay in the clinic or do I go to the ICU? I'm willing. Always say or show that you are willing to help. The moment they think that you are trying to escape from your job, that is against you.
that's
So
true.
never
See,
say
that's what I
no.
tried to do. Exactly. That's why I tried to say I will help out. But then in the another instance, the chief resident who interviewed me, he said, yes, you should not risk the patient's safety because you have done your duty, you're tired, you will ultimately not perform to the best. So that is why you should not go help out, but you should reach out to the chief resident and ask for someone to just assist you. So I was like really caught off guard. I'm like, oh my god, what do I do? Like,
That's why you have a hierarchy, as you said. We have chief resident, we have attending levels. I mean, you are not working alone in the clinic. You're working under somebody. So you should go to that person and say, look, they're calling me to ICU. Can you help me out? And that's over. Leave it to somebody else.
that's true.
Don't take responsibility for you are not responsible for. All right. Thanks, everyone.
Thank you
Okay.
so much, Dr. Kothari.
Okay.